Thank you. Good morning. I'm Stephen Wyatt. I'm Head of Research and Policy at the Strategy Unit. I'm going to be talking about GP consultation rates and how they've changed over the last 25 years. This is the preliminary results. It's one aspect of a project I've been working on for the Midlands Decision Support Network. So during the presentations, I'm going to be drawing various lines on this chart. So I'll just try and orientate you in the chart first of all. So the chart moves from, it's a time series chart moving from 1995 on the left through to 2022 on the right. And the vertical axis is crude GP practice consultation rates. So the number of consultations that an individual will receive per year on average. There have been lots of previous studies that have looked into this question, really good studies, and I'm going to show you what they say. But there are some gaps in our knowledge, and I think it's important we get a really good handle on this quantity of interest. Just to engage you a little bit more in the presentation, what could be quite a dry presentation, I might ask you to just to, in your mind, draw a line on this chart. What do you think has happened to GP consultation rates over this period? How has it changed, and what level do you think it's at? While you do that, I'll just talk about why I think this is an important question. Access to primary care is always at or close to the top of the list of concerns that patients have about the NHS. There are lots of things for patients to be concerned about at the moment, but this remains one of the main concerns they've got. We spend about £30 billion on primary care every year in the NHS, and I think it's reasonable for us to understand what the key output measure is for that service. It's the service that patients interact with most frequently in the NHS, and it acts as a linchpin. You know, when primary care services are working well, the rest of the service has a fighting chance. When primary care is struggling, then all the other services that link off it also struggle. So I think it really is important that we get a good handle on this measure. I mentioned that there are some existing sources of information on this topic. So there are three types of information. There are some studies that essentially try to estimate consultation rates by asking patients to recall how often they've seen their GP or when the last time they saw their GP. And for a long time, that was the main source of information we had on this important question. Then about 15 years ago, researchers started publishing studies which were based on databases of extracts of records from GP clinical systems. And then most recently, 3 or 4 years ago, NHS Digital started to routinely report the counts of appointments that GP practices offered. Appointments are slightly different currencies from consultations, but a closely aligned currency. And I'm going to talk a bit more about some of those research database studies now. So those research database studies tend to draw from one of 6 well-established primary care research databases. These are the 6 that I'm aware of, at least. 3 of them draw data from a subset of practices that use the EMIS systems. 2 of them draw data from TPP System 1 practices. And 2 of them draw data from a subset of practices that use the vision systems. And various researchers have done studies using these databases to estimate consultation rates in the past. The first of these that I'm aware of, at least, is from Julia Hipsley-Cox. She published a number of papers. The last of those was in 2009. Then there were 3 papers published around the same time. Natasha Curry from the Nuffield Trust, Richard Hobbs from the University of Oxford, and Becky Baird from the King's Fund all published papers on consultation rates around the same time. The Hobbs paper is probably the most widely cited paper on this topic. And then more recently, only about 6 weeks ago, Emma Vestesen from the Health Foundation published a paper using CPRD Aurum, one of the new research databases. And then I mentioned that NHS Digital have started publishing accounts of appointments. They draw on all these clinical information systems, and they've been publishing data for the last 5 years or so, the most recent data published a few weeks ago. So I'm going to show you what those different studies have found over the last few years. So this is the Julia Hipsley-Cox study. So she found that consultation rates increased from just below 4 to about 5.5 over the period from 1995 to 2008. This is the Richard Hobbs study from 2007 to 2013, showing rates increasing from just below 5 in 2007 to just above 5 in 2013. This is the Natasha Curry paper, the very high rates she estimated, but also increasing over the same period from about 2010 to 2013. And then Becky Baird's paper covered roughly the same period, 2010 to 2014. So what do we make of these different rates? Clearly they're all showing a similar trend, but they're all estimating very different quantities. And the source of variation here might be the underlying clinical systems, it might be the research databases and the way they've curated the data. Probably more likely it's the way the individual researchers have defined primary care consultations. There are lots of different ways in which we can define primary care consultations, and at this point at least there wasn't any standardized way of doing that. So I'm going to show you the more recent studies now. This is Emma Vestesen's study. Is that yellow line showing on the chart? You can see that, can you? Yeah, great. So she showed rates decreasing in 2020, as we might expect with the COVID pandemic, followed by a sharp rebound in 21, 22. But she noted that her rates were somewhat lower than all of the other studies that have been published. And then this is the data from NHS Digital, the appointments data rather than consultations. So they also show a drop in 2020, followed by a rebound in 2021 and 2022. So there's a bit of a gap here, isn't there, between the period from 2013 through to 2018. What do we think has happened to GP consultation rates over that period? My eye wants to draw a line between some of those earlier studies and the later studies and try and draw some conclusion from that. But we just don't really know whether or not the definitions that these studies are using are identical. And you know, Emma Vestesen's paper uses CPRD-ORM. It's the first study I'm aware of its type that uses CPRD-ORM to estimate consultation events. So I think what we ideally would want is a single study, or a study that estimates these rates over the full period from a single source, or multiple sources. That would be even better. And that's what I've been working on. So I've been using CPRD Gold and CPRD-ORM. CPRD Gold is a very well-established database from vision practices, but the participation on that system has been declining in recent years as practices have moved away from vision. And the other data set I'm using is CPRD-ORM. It's a much newer database, much less well curated, but it's a much larger study sample. So I've been drawing patient samples from those two databases, years stratified, exposure-weighted random samples, about 20,000 patients per source per year, so a total sample of about 1.1 million patient years. I've been building models on those samples. These are relatively simple, negative binomial mixed effects models. I'm estimating consultations as a function of year, age and sex interacting, practice as a random effect, with an offset variable to take account of different exposures, patients who might die, for example, during the year or move practices. I then combine that data with population estimates by age and sex and year to estimate consultations by year from the two sources. I'm going to show you what the results are now from the CPRD Gold data. So the estimates I've got show that, like the other studies, there was an increase in consultation rates between 1995 and about 2012, 2013. But since then, consultation rates leveled off and have slowly declined. You'll notice my data point ends in 2019. I'll cover the more recent periods in a minute. The good news is that corresponds pretty well with the Richard Hobbs paper that used the same source. He also used CPRD Gold, so our two estimates correspond pretty well. That gives us some confidence, I think, in the estimates. These are the results from CPRD-ORM. Similar trend, increasing up until about 2012, 2013, but have since been declining. And there was a bit of an uptick between 2018 and 2019. And the other study that used CPRD-ORM is Emma Vestesen's study. We have 2 years in common, and the two data sets, the two models, can come to very similar conclusions for those two corresponding years. So again, should give us some confidence that we're counting things in similar ways. So the two studies, both of them together, both show GP practice consultation rates rising to about 2012, then declining up until 2019. So I remember these are crude rates. So this kind of suggests that consultation rates haven't even kept pace with the growth in the population, let alone levels of need within the population, which I suspect have grown at an even faster rate. And over this period, the number of GPs, permanent, fully qualified GPs, hasn't really changed. But the number of other GP practice staff has increased quite considerably. But we should probably remember that GPs are still the main delivery vehicle for consultations in practices, and since 2012 we've been asking GPs to do more and more non-clinical activities, to participate in commissioning activities, to act as the local leaders for health and community services within local neighbourhoods. And GP time is a limited resource, and if you ask them to do those sorts of tasks, then there'll be less time available to do clinical consultations. So there's some other work I'm planning to do next. These are preliminary models. I need to do a few more checks to confirm. I wouldn't have presented today if I thought they were going to change substantially, but there are a few more checks I'd like to do. I've got the data for the COVID period, but understanding, well, COVID impacted quite significantly on primary care, but it also impacted on how they record data. Lots of new codes were created, and I just need to make sure I'm capturing those really appropriately and correctly. There's also the impact of COVID vaccinations that I want to try and strip out from the data if I can. I've been presenting results today on consultations as a whole, but obviously there's lots of different types of consultations within that. GP consultations, nurse consultations, consultations by other healthcare professionals, face-to-face, traditional face-to-face surgery consultations, telephone consultations, home visits, and quite novel forms of consultations that have emerged in recent years. And we'll be able to show the results of my models by those consultation types. I've got that data, just didn't have time to fit it into the presentation today. The other thing I've been doing is tracking levels of need for these services. So I've been using the Cambridge Comorbidity Score to understand how patients' needs have changed. And in the later models I'm building, I'm taking account of those need variables as well as just age and sex. What I'd like to do at the end of the project is to do two things. One is show how consultation rates have changed relative to need, but I also want to be able to provide ICBs with some understanding of how their reported appointment rates from NHS Digital compared to levels of need within their area, to show expected results from our models about how many consultations they might need to deliver given the age, sex profile of the population, and ideally their comorbidity mix as well, compared to the actual reported number of appointments that they deliver that are reported by NHS Digital. That's everything from me. Thank you.
Thank you very much. And I think we've got time for a question or a couple of questions for Steve. That gentleman over there, Mr. Farr. Oh, did I miss that? Sorry. Thank you.
Quick question. Do either of the CPRD data sets record consultation duration? Do they, I mean, are people seeing their doctor for longer, if not so many times?
It's a field that exists in at least one of the two databases, but it's not particularly well populated until recent years. But that is one of the possible conclusions, isn't it? That maybe we're seeing reductions in consultations, but consultation time has steadied or even increased over that period because practices are spending more time with patients. I would say maybe in balance to that, we've seen a rise in telephone consultations over that period. I think there's mixed views about whether they're quicker or not than face-to-face consultations, but I would expect, at least on balance, they might be mitigating some of the rise in consultation time. The other thing I didn't report, but I think there has been a concentration of appointments towards those people most in need. So there's an increasing number of people that don't get any consultations at all, but those that do get consultations are getting more, and that might be a function of triage arrangements in primary care. As they become more and more pressed for time, they're finding the need to be more clinically rigorous about who they actually see. Maybe that's a good thing, maybe not.
Thank you. One more question.
Thanks, Steve. Really interested. Can you, in your hypotheses, can you look at where that activity might have been displaced? Because you were starting to hypothesise about people using maybe pharmacies or going into acutes unnecessarily. Is that possible even, do you think? Yeah.
Well, there's a really good measure of primary care amenable ED attendances that has been developed and worked on every year, I think from Sheffield initially. So what I'd like to do is track these rates against that to see whether or not people are attending ED more and more because they can't get in to see their GP for relatively simple primary care type activity. Ideally, panel data set methods to try and draw the association between those two quantities.